And then you have Black Americans who are experiencing it at double the rate of African immigrants. You have Caribbean immigrants who are somewhere in between those two, and you're lumping them all together, where of course you're masking the true effect of racism and how it's impacting the Black birthing population. And so from a quantitative standpoint, this is a data justice issue too, because we're invisibilizing populations that exist, right? And we see that quantitatively across a lot of different, disabled people, indigenous populations, Middle Eastern populations. There's a lot of people that we collect data on and have them check boxes that don't fully capture their lived experiences and their experience with racism. And I think that's only in service of the opposite of what our goal is. So it's a data justice issue as well.
Hey friends, welcome to Public Health Careers. I'm Omari Richards, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career stories. You'll hear diverse career stories, absorb professional development, career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Dr. Yanica Faustin. Yanica is the founder of Interdisciplinary Health Equity LLC, which provides consulting, speaking, and coaching, all aimed at centering community and data in the fight to move equity forward in programs, organizations, and leadership teams. She's also a recipient of the Health Equity Scholars for Action grant from the Robert Wood Johnson Foundation. She's a researcher, equity strategist, methodologist, and advocate committed to building health systems that are both inclusive and just. She's dedicated to fighting for health equity by merging evidence-based strategies with community wisdom, ensuring health systems work for those who are often the most marginalized. She conferred a Bachelor of Arts in Biology and an independent major interdisciplinary in Philosophy and Biology titled Ethical Genetics, then a Master of Public Health and Community Health Education at the University of North Carolina at Greensboro, and a PhD in Maternal and Child Health with a minor in Sociology at the University of North Carolina Gillings School of Global Public Health. In today's episode, you'll hear and learn more about why community-based participatory research is essential for addressing health inequities, how lived experiences of communities provides invaluable insights for research, why cultural humility is vital for all public health professionals, the importance of community wisdom and data-driven strategies cannot be overstated, and why data justice is crucial for accurate representation, and why we should look at data from a diasporic focus, and much, much more. Be sure to hit that subscribe button, share this episode with someone that would enjoy it, and enjoy.
Hi, this is Dr. Yanica Faustin. I'm a health equity scientist, and you are listening to Public Health Careers.
Yanica, I'm so excited to talk to you today. Welcome to the show.
Thank you for having me. I'm excited to be here.
It is my pleasure. And to jump into things, how do you identify, and tell us a little bit about your personal background?
Yeah, so I identify as Black, Haitian American, and a queer woman. I use she, her pronouns. I'm a wife, a mother to an 8-year-old, a 6-year-old, and a 1-year-old. So I'm very busy these days. I'm from Brooklyn, New York, and I live in North Carolina now. That's how I identify.
Well, I appreciate that, and I can imagine that you're keeping yourself very, very busy.
Yes.
And definitely would love to try to find some time to connect in person as well. I think that's one thing that I'm trying to do more in 2025, so we can connect on the back end about that.
Great.
And then another question just come into my mind right now. Being a health equity scientist, with all the conversations on DEI, how are you feeling? What's going on in your world?
Yeah, getting on LinkedIn these days is so different than it was just 2 weeks ago. And just seeing all of the different posts around freezes that are happening at the different federal agencies and the real decisions that people are having to make. Real people who have children, who are taking care of others, who are taking care of themselves. And just the massive amount of work that's been put on freeze is alarming for sure. I think everybody wasn't expecting things to be this quick, although we, kind of expecting the worst, hoping for the best, but it's been really fast. So that's been something we've all been talking about, like all of my public health professional friends and even people who aren't in public health, but maybe are doing DI work, or just everybody's talking about it. Everybody's trying to make adjustments and imagine what the future could look like for the next 4 years, but also beyond, right? Because these types of rollouts are going to have effects way beyond 4 years. So really just trying to reimagine what careers can look like and life can look like.
Yeah, it's a whole totally different landscape, and you're right. The conversations and I think the frustrations and all the worry is there with people not knowing what's happening. I know a lot of people had contracts like canceled immediately, internships canceled,
Mhm.
conferences canceled, and I guess to the public, like just health information and communication just isn't happening, and we
Yeah.
don't know what kind of impact that is going to have. And I guess in that, thank you for doing the work that you're doing, and let us know how we can continue to support you.
Oh, thank you. That's so kind.
Of course. So jumping more into some of your expertise here, what role does community-based research play in addressing inequities in Black maternal and child health?
Yeah, so personally, I think CBPR or community-based participatory research or any type of community-based or community-driven approach to research is really essential. I think it centers the lived experiences of the communities that are most affected by the inequities that we're often trying to conduct research on. And a lot of times, these communities have wisdom that is invaluable just from living there, playing there, working there, often for generations. And that usually gets overlooked in traditional research, and often in the way we're trained as scientists at some of these top universities. And so I think it's really wonderful when you can incorporate community and when you can get training in that. And luckily for me, I had a lot of training in CPPR throughout my academic path. And so it's really at the heart of my work.
And when in your path did you realize like this community-based work is so important and it's something that is needed throughout the work that you're doing?
Yeah, I think the way I realized that formally was in my master's program. I had like a practicum type of requirement to fulfill, and I was partnered with a community academic partnership, a collaborative that worked on health disparities work at the time, was what it was called. And they worked very closely with community and then a lot of academics. So my preceptor was a professor, but I, was required to attend all of the community academic meetings and really for the first time in my public health training at that time was exposed to community members being treated with the same amount of respect and authority as the PhD academics in the room. And that happened during my second year of my master's program, so very early on in my public health training. And so that's kind of shaped how I've moved forward in my career. So I'd say formally that's how I realized community was important. But I think the way I grew up and where I grew up, it was very like I informally that was kind of always in my background of how I was raised. Just the importance of community.
Yeah, and like I can imagine just like how the experiences that we have, not like I guess growing up and our lived experiences, as well as being in a professional setting and then seeing the value that we can put on lived experience, and we should put on lived experience when we're asking people to share their expertise on different issues. And I would imagine that you believe very similarly that the issues and the issues that we face, the solutions are going to be found in the most impacted and the most vulnerable communities. So, with that being said, we need to continue to support and uplift those communities.
Right, exactly. That's exactly it. Yes.
And can you share a success story from your work that highlights the impact of community engaged research?
Yes. So I am really fortunate in that I was recently, almost a year ago now, awarded the Health Equity Scholars for Action grant from the Robert Wood Johnson Foundation. And through this grant, I've been able to create a project that has a community advisory board and partners with community organizations. So it's been really exciting because it's the largest project that I've led that incorporates community based work. And so we have had some challenges along the way, as one does when you're conducting a large qualitative research project and doing original data collection. And the Community Advisory Board has truly been vital to the success of this project. And when we had an issue with essentially fraudulent participants, we had to pivot pretty quickly and create a like multi-tiered stepped approach to data collection, like really change the protocol. And the community advisory board really was key to developing that, to ideating new steps in the protocol, giving examples of things we could do, thinking of, orgs that might be pivotal to partner with in that regard, and even pushing me to think about, like, encouraging me to be more vocal about the project and think about ways that I can be more visible. And that's kind of not my style. I'm more like, be in the background type of person. And so I was kind of pushing back with oh no, is that really necessary? Like I could, and they really pushed me to, and we're like, no, people need to see who's doing this research. People need to hear you talking about this research. Like, that people are considering participating need to know that, this is what face is behind, inquiring about racism and maternal health. And I recognized the value in that for sure. And so having to push myself to record videos for recruitment, and which I was not planning on doing. But it really showed me, like, I remember getting off the meeting and being like, wow, like, this is the value of a community advisory board. Like, they're going to have perspectives that I don't have. They're going to see things that I don't see. And they're going to push me in a way that I'm not going to push myself. And as long as I'm listening and I'm being flexible and I'm willing to, do all those things, and we can work in tandem and really create something that's more powerful and rich than it would have been without them. So I consider that a success.
And in your experience, what allowed you all to choose people on this community advisory board that would help you all to shape the work that you all were doing?
Yeah, so I was fortunate to have two research assistants that are part of the team. And so on my research assistants, I spent time discussing, the project with her. And when she learned what it was about, I said, I need to create a board. And so she spent time doing research and finding people who are in New York City who are doing maternal health work. In addition to that, I also thought of people that I knew, because I'm from New York City, and in the community, who I thought, would also add some valuable lived experience as Black birthing persons, as mothers, as Caribbean people or African people or Black American people, who aren't necessarily in the maternal health field. Because I think even diversifying beyond, like, profession, so teachers, bankers, lawyers, journalists, and then also some people who don't have children yet, and, like, what are those thoughts that they have? What are the things that they are hearing? So a combination of that, plus, like, yes, we have, OBGYNs, and yes, we have midwives and doulas and lactation consultants, but also having other people as well.
I think that kind of speaks to the interdisciplinary, multidisciplinary, various perspectives that are so important in like having a robust solution or conversation around a topic. It can't just come from one area of the population or one perspective. You really need to have many different people having their 2 cents shared on that.
Exactly. And I very much value interdisciplinary approaches to problems.
Absolutely. And how do you approach community wisdom with data-driven strategies to create meaningful health interventions?
hmm So, I also am a methodologist. So I think a lot about the way I do my research, in terms of why I'm using the methodology that I'm using. And I'm trained in both, like, quantitative approaches as well as qualitative approaches and mixed methods, and a lot of different sorts of data collection approaches. And so the way I think about merging community wisdom and input with data-driven strategies is often through the methodology of choice. Um, I think it's difficult to merge community wisdom when we're doing strictly quantitative work. I think that the mixed methods approach really helps to blend those qualitative insights and those stories and lived experiences with that quantitative data. Um, and then I think also incorporating community in every step of your design, from the formation of your question to the dissemination of your results, like just having community at every input. And it doesn't always have to be as formal as a CAB, as a community advisory board. It could just be, a community ambassador, or, a community, you know, people who communities and people who are members of the community whose narratives you consider, as you're designing your study, point person that you can consult. But just, I think it's important to incorporate community at every step of the research process.
Love and support that completely. In your work doing this community-based research and the other research that you've done, were there any specific like programming languages that have been important or that you've used?
Yeah, so I've used Photo Voice before. I don't know if you know Photo Voice or
Mm-hmm.
yeah. So that's like, really rooted in community. That entire approach. Like you cannot do a Photo Voice project without taking a community-based approach. So that's a really, I think, easy way to know that you are going to incorporate community when you're doing Photo Voice, if you're doing it correctly, like if you're doing it the correct way. So I love Photo Voice. It, does take more, I think, time and attention. Just, being thoughtful about giving time for people to take the photos, giving instructions, really introducing them to the process. And then like when you're doing the focus group portion, going through the steps to analyze the photos after. But I love that approach. Trying to think about other programs or anything like that. I mean, that's one that I can think of. I mean, I think using having a community advisory board is really important too. Yeah, and just thinking through like what communities you're a part of and what communities you're not a part of. And how, you might have diverging viewpoints and I think it's important to not build a community advisory board that's just, yes people. I think that's really important. I've seen that happen before. And then you're just getting affirmation that everything you're doing is correct when, it's almost impossible to be completely perfect, right? So there's got to be somebody on there that has some dissonance, some diverging thoughts, because then you're going to create a better product in the end, I think.
Yeah, absolutely. Definitely need people to push back and to not only be thinking the same way as you. So definitely appreciate that. And I also know the value of Photo Voice. It was one of the things that I was able to lead a project on when I went to Alaska for my fellowship. So
Ooh,
I know that process of like having those meetings, having those focus
yeah.
groups, and the challenges all in that. But I think the end product is really something that's so valuable, not only for the research and the person that's doing the project, but for the community to kind of like look and see, hey, these are our stories, these are the things that are important to us, and this is what we wanted to share. So definitely, if you all are not familiar with Photo Voice, definitely recommend learning more about that.
Alaska, that sounds cool.
It was cool and cold, cool and cold.
Literally cool.
Yeah. It's actually funny because I think last week it was snowing in Florida, but in certain places in Alaska there was no snow, which is right. It's just a crazy world we're living in right now in many aspects.
Mhm.
Uh, so before we get to your academic pathway, I would love to ask, what does public health mean to you?
Mhm. I mean, I know it's corny, but like public health literally is everything. Like that whole bumper sticker. I mean, I don't know if they're even doing it, but I remember when I first got into a PhD program, I felt like that "this is public health" sticker was everywhere. But um, I think it's really a tool in a field that is dedicated to progressing equity forward and creating systemic structural transformation. I mean, ideally, that's what it is. It's um, that's what it's created for, in my opinion. It's about addressing the root causes of health disparities. And I think it's, the more, I mean, it might be like my bubble on LinkedIn, but the more that I'm on there and the more I mean, it's definitely my bubble, like, because the algorithm, when I think about it, feeds you what you want to see. But I feel like when I'm on LinkedIn, that it's clear to me that public health for me, in my viewpoint, in my bubble, in my world, is all about empowering marginalized communities. It's all about advocating for policies and practices, that promote health equity. So I think for me, that's what public health means to me. Like it's about improving the health of all, and the way you do that is by focusing on those that have been the most, the communities that have been the most dismantled and marginalized and oppressed.
I like the part about like public health also being a tool. I think that's a part that a lot of us kind of miss. But I think it is a tool and a perspective in viewing like the world and the work in a certain way. So appreciate that. Okay, so before you were Dr. Yanica Faustin, you began your journey and you got a Bachelor's of Arts in Biology and independent major in ethical genetics. Why did I not have the university? I do not have the university. Yes, so maybe you tell us the university and tell us about the thought process going into there.
Yeah, absolutely. So I went to Colby College, which is in Waterville, Maine. It's a small private liberal arts college. And, really my academic journey. So I ended up at Colby through a scholarship from the Posse Foundation. The Posse Foundation is a leadership scholarship. So they give out leadership scholarships to students. And at the time, I'm not going to date myself, but at the time they were much smaller. So they were in New York and a couple other places, and now they're like everywhere, like Puerto Rico, everywhere. And so I got this Posse scholarship, and I went to Colby. And while I was there, I've always been into science. Like I always knew I wanted to be a scientist, so I majored in biology. And I should also say, so I went from like Brooklyn to I'm from like the Prospect Lefferts Gardens neighborhood, if anybody knows where that is. So it's like near Grand Army Plaza, Prospect Park. Like that was the neighborhood that I grew up in. Then I went to Maine, Waterville, Maine. Not even Portland, Waterville. So it was very different from where I grew up, and it was kind of my first time leaving. It was my first time leaving New York City, really for a long period of time. And I knew when I was sitting in my biology classes, as I was like learning, that I was desiring a way to question what I was learning, if that makes sense. And so that's when I started thinking through philosophy. Like I took a philosophy class to meet, the liberal arts colleges, so I was meeting another requirement, and then I was really intrigued by it. And I thought, what if I made an independent major that kind of tied in? I was taking a lot of advanced genetics and genomics classes because at the time I wanted to be a genetics counselor. A genetic counselor. I didn't know what I never heard of public health, as most people at that time did not know about public health in their undergraduate studies. And so I was like, okay, I know I want to be a geneticist. I'm taking all these advanced genetics and genomics classes. I really want to couple that with philosophy and take a lot of like ethics courses. So I created this independent major that tied in both of them and called it ethical genetics. And that was really kind of that intentionality with creating interdisciplinary major. And then I also double majored, and then I also had a regular biology major as well. That really allowed me to like bridge that gap between like the biological science and then the moral and social implications of genetic research is what I was focusing on, but really science research in general. And I think like in a lot of ways, without knowing about public health, that was like the beginning of this interdisciplinary approach to, just thinking through why we're doing things the way we're doing them and how we justify doing things the way we're doing them. And like, especially with a long standing field like biology, which has a lot of ties to problematic, methods and people. Right. So I think it was a really, really strong beginning to shaping like this interdisciplinary, multifaceted experience that would later end up leading me to public health.
So I'm imagining that the scientist that you were envisioning maybe at that time was more a lab scientist, or am I envisioning that? Yeah.
Yeah, I even had a work study job for 3 years at Colby where I worked in a genomics lab. Yeah.
Okay.
Mm-hmm.
So I'm looking forward to seeing that like transition and that thought process, and maybe even just like how did you learn more about public health? Because like I could imagine looking back on it and thinking about moral and social implications of genetic counseling and how that could relate to public health. But maybe in that specific time when you were doing it, it wasn't something that was like standing out to you in that sense. But I guess we'll get to that in a little bit. While you were in your bachelor's program, you had a few different roles. I will list them out, and then you can go through them as extensively or least extensively as you'd like. So you were a cabin counselor and unit leader at the Hole in the Woods camp at Double H Ranch. You were a research genetic counseling intern at Children's Hospital of Boston genomics program, and a research assistant and clerk at Colby Fund Office.
Yes, I was all of those things. I haven't thought about them in a very long time. Yeah, I think so. The Double H Ranch, amazing place. That's actually where I met my now wife in 2007. And it's a camp for kids with life-threatening illnesses. So As you can imagine, I went there because, so they're also a career partner with the Posse Foundation. So I found out about them through the scholarship that I had at Colby, and then I decided to go there because I wanted to be a genetic counselor, and they had a lot of kids with like rare genetic disorders and also very common ones like sickle cell, muscular dystrophy, also kids with HIV, spina bifida, all types of different conditions. And I learned a lot in that setting. I actually ended up working there for full time for 3 summers. If that's right. I think so. Yeah, I think I did counselor 2 years, then unit leader 4 summers. 4 summers. So clearly I loved it. It was a very hard job, long, working really hard. A beautiful place though, because they make it so that kids who typically throughout the year don't get to maybe go to PE class or experience certain things get to go to camp and just be a kid, because there's a medical team, and then we're trained on how to handle different issues with conditions, and they get to go to an amusement park, and we're trained on how to do lifts and how to watch out for different signs of someone going to sickle cell crisis, for instance. And so you get a lot of like some medical clinical training, lift training, and then in general you just learn to work on a team with people who are different from you for a really good cause. So I guess kind of a microcosm of public health in itself. Yeah.
And how about the other roles as research genetic counseling
Yeah.
intern and research assistant?
So I really, the genetic counseling internship at Children's Hospital of Boston was really amazing. I think especially at that time, like again, at that time I was in like my prime, I'm going to be a genetic counselor, like mindset. I've always been a very like planner. So that was like, I remember I had that on my plan from like freshman year. Like I will work at Children's Hospital of Boston because they had a wonderful genomics program. And I remember I was really excited because I got to work with Lou Kunkel, who was one of the people who discovered the dystrophin gene. I'm going to nerd myself out now. So I was really into genetics. So I was like really excited that I got to meet him and work with him. And what was really amazing about that position actually is that I had an amazing boss. I'm like completely blanking on her name now, but she really, she just really, for some reason, really liked me, and very much like invested in what I wanted. And so she really allowed me to have all the shadowing experiences that I wanted. Like, so I would shadow not just her, but like a bunch of other types of genetic counselors to get a feel for the field, to decide what I wanted to do. And that was actually when I left that internship, I decided I didn't want to go into prenatal genetic counseling like I thought I did, because it was really sad to sit there and watch the prenatal counselor tell a pregnant mother that that they just discovered what their child had, and just watch that was like, I was like, oh no, I can't do that. This is too difficult. And so I was like, okay, I know I want to work with kids, so I'll be a pediatric genetic counselor where you already have a child who has a condition, and you come in and you're trying to learn about gene therapy or learn about more things about the condition. So I guess it taught me that clinical settings might not be my strongest place because of the emotional toll of it all. So that was one thing I learned from there. And I had a really great supervisor who really taught me that I can ask for the experiences that I want to shape the career that I want. And I learned a lot about ethics there too, like sitting in on the conversations the doctors were having during like grand rounds and things like that. The geneticist was really interesting too. So I incorporated a lot of that. I remember in my final project for my senior thesis. Then the Colby Fund, I worked at the Colby Fund all 4 years when I was at Colby, and it was kind of like my second home while I was on campus, and it was filled with some amazing people who really showed up in a lot of ways for me while I was there. So I'm really grateful to the Colby Fund, and I learned a lot there about philanthropy, and the importance of giving back to a place that has shaped you, and not just academically, but as a person. And actually, it was like the chair of of Colby Fund giving for my senior class, and we ended up breaking the record for having the highest participation. Shout out to Colby class of 2010. And yeah, it was like one of my largest leading roles while I was on campus. I did a lot of leadership while I was at Colby. That's kind of the premise of the Posse Foundation. is part of it is that you're going to be a leader on campus as well. And so I was in a lot of leadership roles while I was there. And Colby Fund, my senior year was one of them.
That's awesome. And like I guess that's awesome for you to have like this vision of, okay, these are the things that I wanted to do. I wanted to go and work at this genetics program and really like get that experience. And in doing so, as we always do, we learn more about ourselves and we learn more about maybe some of the things we do like, some of the things we don't like, and it kind of like continues to shape our journey. So before we talk about the next part of your journey, were there any undergrad takeaways that you wanted to share?
Mm. In general, my time at Colby really prepared me for the world that I entered afterwards. I remember when I got to Colby, I thought, man, this place is so weird because it was so different from where I grew up. And then I learned pretty quickly that, like, oh, actually, the world is more similar to Colby than my neighborhood in Brooklyn. I kind of thought like everywhere looked like my neighborhood in Brooklyn. I learned that it's actually more like Colby. And I learned a lot about how to navigate structures and systems there. I learned a lot about people who will invest in you, people who value you. I learned a lot about your worth being in your network sometimes, like who you know. I learned that a lot there. And I got a really, really strong education. Very, very good. Which, I say out of all three of them, Colby was definitely my hardest. Out of all three, getting my bachelor's in my heart was harder for me than my master's and my PhD, which is saying a lot to what it was like to be at Colby.
No, shout out to Colby again. Oh, that's good at that. Thank you for sharing that. So you did continue on to get a master's of public health in community health education at the University of North Carolina at Greensboro.
Mhm.
So firstly, walk us through that process of maybe like learning more about public health to then coming to the point of saying, okay, I'm going to get this master's of public health, and yeah, walk us through that.
Yeah, so it's actually kind of a crazy story. But my senior year at Colby, so Colby has this thing called Jan Plan, which is like a winter term in January, and you have to do three of them while you're there. And so my senior year, I had already done all three of them. So I decided during January I was actually going to take a trip to my second home in a way, to Haiti, which is where both my parents are from, and I hadn't been there since I was like 10 years old at the time. So I was like, oh, I'm about to turn 21. I haven't been there since I was 10. It'll be like a nice homecoming before I finish my senior year. And January of 2010 is when the earthquake happened in Haiti. And I was there for probably 2 weeks before, or like I guess 12 days before that. Um, and then about 3 or 4 days after that. And that was actually how I discovered public health. So while I was there, as you can imagine, it was quite a public health crisis. Now, I didn't know to label it that at that time, but it was wild. And I ended up getting typhoid fever from drinking contaminated water. Um, and then when I arrived back to the U.S., I had to be treated for the typhoid fever. It took them all to figure out what I had, but then treated for typhoid fever. And then when I got back to campus, my academic advisor at the time, and really my mentor, she was also my research mentor in the genetics and genomics lab, Dr. Judy Stone, who's really amazing. She gave me my graduation gift early, which was the book Mountains Beyond Mountains, which is all about Paul Farmer's work in Haiti. Um, and she had already like gotten the book for me as a graduation gift, and then this had happened, and so she gave it to me. She was like, I think you need this now. She gave it to me early, and I just like read that book cover to cover very quickly multiple times during my senior year, and I was like, oh my gosh, like, and it was just perfect. I had just had this experience, and then the book was about Haiti, and so it's about public health, and I was like, this public health thing, I think this is what I want to do. Like, I think I want to do this. Like, I want to have a real impact and create real change in a different way than I think I can do as a genetic counselor at, a hospital. And so, yeah, spring of my senior year, I decided to pivot. And I'm very much a planner, so for me, it was kind of like a moment of crisis. Like, I was like, oh no, like I've been doing all this. But I just started being strategic and thinking about how what I have already learned in biology and philosophy could, translate to public health. So then I took a year off from school. But I worked in the lab. I worked at LabCorp actually, because that's what you can do when the skills you have are pipetting and you have a bio degree. So I got a job at LabCorp, and I was really great there. And I worked there for about a year, and then I applied to get my MPH because I thought that'd be a great start, considering I didn't really know much about public health at that time. So.
Okay. That is quite the story indeed, and I can imagine just how that experience would solidified and formulated that idea. Like, this is something that I really want to pursue. This is something I really want to learn about, and yeah, kudos for you for taking those steps, and looking forward to hearing more about the next part of your journey. So, while you were at UNC Greensboro, you had a few different roles. You were an independent contractor at the Wayne County Health Department, a graduate assistant, graduate research assistant at UNC Greensboro, graduate UNC Center for Health Promotion and Disease Prevention, project coordinator for the Center for Global Health at RTI International. So walk us through some of the roles and experiences you had there.
Oh my goodness! Wow, it's just like this is so in depth. You're going down memory lane here. Okay. So, I mean, a lot of what was really amazing about that program is it does really focus on community health. So, my training in public health began with a community health perspective, which I don't think is the case for everyone. So, getting my MPH in that community health education program was really rooted in communities, community-based approaches. And so, that practicum experience at the last one you listed, or the second to last one you listed, that practicum experience was when I got to work with the Community Academic Partnership. And then the graduate assistant and graduate research assistant roles were working with professors who were working on community health related projects. And so a lot of the professors in that department worked on community health research. So all of those experiences really shaped my approach to public health. And then through professors there, I got connected to really my first consulting job, which was working with the Wayne County Health Department and helping them create a resource guide for kids with children with special healthcare needs, which linked well with my previous experience at the camp. And so that was one reason why I was recommended for that role. So I was able to use that understanding and with my emerging public health degree to work with the Wayne County Health Department. And then actually I graduated with my MPH and then got the job at RTI like 3 weeks before I graduated. I remember they had me start immediately, and I had to take PTO for my graduation day. I was like, can I wait till I graduate first? They're like, we need you now. And so then I worked at RTI, the Research Triangle Institute, here in North Carolina, and I worked for the Center for Global Health there on 2 different projects. One that was focused on maternal and child health, because during my master's program, that is what I focused on, which was really actually rooted in my experience in Haiti, because that was where, while I was there, I noticed a lot of just maternal and child, what I know now to be maternal and child health issues. Basically like women and children in need, and during the aftermath of the earthquake, a lot of aid. People would just get on the aid trucks and grab stuff, and oftentimes it was men who were able to do that. And so, just thinking a lot about the role that women and children play in a nation, all nations, and the importance of, I think a lot about how I focus on MCH as well, because I think you can tell the health of a nation by the health of its mothers or the health of its birthing persons. I think that's very true for the U.S. And a lot of other places. And so that's why I wanted to focus on maternal and child health. And I was able to do that at UNCG with a community health angle. And I took that to RTI. And then they also wanted me to work on, the other team I worked on was actually drug development. And I was able to do that because of my biological and chemical science background. Because at Colby, you take chemistry classes when you're a bio major as well. So I was able to use, and then there comes the interdisciplinary piece again. In that role at RTI, I was using my public health degree, but I was also using my science degree from Colby too.
Well, thank you for sharing those experiences, and I can see the intersection of not only getting involved into public health, but then using your biology expertise as well as the the work that you did at the camp with rare disease, and how that kind of just plays into your story and your career. How helpful was the gap year that you took after your bachelor's to, I don't know, how helpful was that for you?
Yeah, I think it was really helpful to take that time to work, and think more about like how I was gonna position myself in public health, like what programs I wanted to go into and to look into that more. I think in general though, it's just good to take time after completing an undergraduate degree to think a little bit about life before you jump right back into something. Unless you for sure, know, then yeah, go for it. But yeah, I think it was really helpful to just take that pause, have a real apartment. Like I had lived on campus the whole time at Colby, so I didn't really, some people don't do that, but I didn't really learn, like grocery shopping that much or like, paying utility bills because I was in a dorm. So it was good to have that experience too before heading back into school again.
Absolutely. And then, were there any takeaways that you had from your master's program?
Again, with like connections, certainly academically learning the importance of communities when doing public health research for sure, but then also just like connections, like the professors I had there connected to me to, my first consulting jobs. And then the practicum I did at the end connected me to UNC Gillings, which is where I ended up going for my PhD because the professors I worked with there were professors at UNC Gillings through the academic partnership. So I made connections so that when I worked at RTI, I was able to maintain those. And then when I applied for the PhD program, I already knew people, new professors there who were familiar with my work and my work ethic and my research interest. And so that really made my time at UNC Gillings easier.
So you got your PhD in maternal and child health at the University of North Carolina at Chapel Hill. Maybe tell us, coming out of your MPH program, you said that you worked for RTI afterwards. What were you planning to get a PhD? Was that a part of your thought process? How did a doctoral degree come into mind, and then why did you decide to pursue one?
Well, so I know you're Trinidadian, so I am the eldest daughter of Haitian immigrants. So when you asked me if getting a PhD was in the plan, I think it was in my parents' plan. um, so I kind of like that was like kind of just set out for me, I think. And I was continuing on that path. But when I was at RTI, I noticed that a lot of the people who were making decisions about things, who got to, write proposals for projects and, go for grants and really design their work, had their PhDs. And being there on the master's level, I was doing a lot of the work and I was learning a tremendous amount. But I had thoughts, I had original ideas, and there was only so far that I could take that without the PhD, is what I learned. And so I was like, okay, got it. I need a PhD. Let's do that then. Then I kind of just looked up, the best public health schools and found UNC Gillings School of Global Public Health, which was right up the road really from RTI. And it was it's the number 2 school in the nation. So I was like, oh, that sounds pretty good. Let me do that. And I knew I already had connections there. So I was like, I'll apply there. So I just applied to that one place. And I had already purchased a home, in North Carolina. So I was like, okay, I think I'm going to be here for a bit. So that felt right.
Yeah. And tell us more about the maternal and child health part of the PhD. How did you decide upon that part?
Yeah, so I had already started doing maternal and child health work a little bit in my master's program with like a lot of my focus on like most of my papers. I always chose MCH topics. I think I've always just been really interested in birth and pregnancy in general, just like as a person. And then when I was at RTI, I was working on maternal and child health projects through the Gates Foundation primarily. And so I was learning a lot about global maternal and child health. And actually, that program at Gillings is one of the few maternal and child health focused public health degrees you can get in the nation. So I was like, okay, this is going to be a really great place to go to, one of the oldest ones as well. So that's how I decided on maternal and child health, really just through my interest and the experience I was getting at through my master's and at RTI. And yeah, so I applied to Gillings.
Okay. And while you were in your PhD program, you had positions as an IntraHealth Summer Fellow at IntraHealth International, and then a few different roles at Elon University. You are a pre-doctoral fellow and instructor in public health studies, co-founder and co-director of the Health Equity and Racism Lab, or the HER Lab, as well as well as an assistant professor at Elon University. So, walk us through those positions.
Yeah, so I did the InterHealth International Summer Fellowship, which InterHealth is very similar to RTI. So it's kind of similar work there. And that, came with some summer funding and, some good like work experience in the field. And then what was the other role you listed off?
Pre-doctoral fellow, instructor in public health studies.
So while I was at Gillings, my original thought was I'd get my PhD and then I would go back to RTI and be able to do the kind of work that I wanted to do, that I saw being done, that I had ideas about. But then while I was getting my PhD, I actually really fell in love with teaching. And really, I guess, like academia, just like engaging in intellectual conversations about these issues and then developing projects and carrying out research. Like I was just like, I love all of this. So then I decided that I would try academia. And I knew at that time that I wanted to be in a place that was similar to Colby, actually, a place where I could be in front of the classroom in a way that I never experienced. During my entire time at Colby, I never had a Black professor teaching me. And that was important to me, to be able to be that for someone else. And in a lot of ways, I really loved the type of learning environment that I had at Colby. And so I was like, okay, I know I want to be at that type of university. So I shaped a lot of my experiences at UNC, which is an R01. So very different from that. Very, very research heavy, research training. I tried to get a lot of teaching opportunities while I was there. So I applied for the predoctoral fellowship at Elon during my last year of my PhD program, so I could get a lot of teaching at a type of university that was similar to Colby. And then it turned out while I was there that a line opened up and they were looking to hire a tenure track assistant professor. And so I applied for that and got that. And yeah, I'm in my 6th year of that now. Yeah. And then while I've been at Elon, I co-founded a research lab as well. So that was really, really exciting to do. And really what I love about that role is that I get to teach, develop curriculums around, I teach research methods. I teach maternal and child health inequities, reproductive justice, senior seminar, which focuses on developing maternal and child health programs that can address health inequities, and then public health practicum, which are, exactly what it sounds like, getting practical experience in the field for the students. And so I love being able to teach. I love being able to develop curriculums around health equity and maternal and child health and reproductive justice for these students who are majoring in public health studies at the university. So I have a lot of research students I've mentored over the 6 years that I've been at Elon. And I really love being able to be a research mentor. I think the most I've managed at once has been 5 projects, if I'm including my own at once. So having the ability to manage 5 different research projects with 5 different research teams, sometimes people on overlapping teams, different methodologies. So I might have 2 quant, 2 qual, and a mixed. I think I always have a mix. So like I always have solely quantitative projects, solely qualitative projects, and then usually at least one mixed methods project. And multiple teams, multiple people delegating, and then just being able to also teach people how to conceptualize health inequities, think about it, talk about it, frame it. I also develop and teach on racial equity frameworks as well, and then just contributing to the field through research, but also through training and teaching and coaching and mentoring these future public health scholars and students.
How do we conceptualize racial equity?
So I think everybody does that differently depending on their training. For me, health inequities are rooted in racism, classism, and sexism. And they're rooted in particularly structural racism that exists in the US. And oftentimes my approaches to my research and the methodologies that I choose are, in effect, approaches that can highlight that. So my work in maternal and child health, I use a diasporic focus. So I look at Black maternal health outcomes by comparing Black people to Black people, which I did when I first started out on that. I did get some pushback on why I wasn't including white birthing people in my target population in my studies. And I just go back to like methods 101, you have to include the population that aligns with your research aims. And if my aim is to determine how racism is influencing maternal health for Black birthing people, then I should solely be studying Black birthing people. And I use the diasporic focus because I actually minored in sociology while I was getting my PhD, which was intentional. A lot of people in the department minored in epidemiology to get their methodological training. And again, that interdisciplinary approach really mattered to me. So I chose sociology because I wanted a different field's perspective methodologically that I could bring to my public health work. And that's like been vital to the work that I do now, because having that sociological approach really helped me understand the different orientations of the Black diaspora to what race is in the U.S. and what racism, this system of valuing people based on skin color is in the U.S. because we have a unique version of it here. And so methodologically, what I do is I look at the maternal health outcomes of Black Americans, African immigrants, and Caribbean immigrants, and see how they differ. And that's been done quantitatively before. And I had a little bit of literature to look at in that regard, but most of the time we compare Black birthing people to white birthing people. That's like oftentimes what we hear about. And there's less looking at looking within the Black population of what the differences are. And the nature of this approach, or why I decided to use this approach, was it really highlights the different exposure, the lengths of exposure to racism in the U.S. That's essentially what it's a proxy for. Black American people, we're talking about being exposed across generations. For Caribbean immigrants, we're talking about having more proximate exposure to the U.S. than, say, the African immigrants, just from geographic distance, but then also being exposed to slavery as well, historically, in a way that the African immigrants have not been exposed in the same way as the Caribbean and Black Americans have had in terms of the relationship to slavery. And then geographically, people who migrate from Africa are just farther away. So like we see that, Caribbean immigrants, for instance, often come to the U.S. at a younger age, and they're often able to do more back and forth. Whereas African immigrants typically have an older age of migration, and then they often aren't able to go back and forth as much. And there's a lot done in sociological literature on the differences between all of these groups and how they, live, work, and play in the U.S. And the demographic of foreign-born Black people has just risen so much since the 80s due to, various migration policies. And in New York City, you have a high rate of Black immigrants. And I knew that from my lived experience. So I remember when I was getting my PhD, I felt very much like, I just keep seeing Black, white, Black, white, Black, white. But like, who's in this Black group that we're talking about? Black is not a monolith. Like, there's very heterogeneous. And I just wasn't finding that. People were talking about that as much in the public health area. But then when I go to my sociology classes, I would hear more about like, Mary Waters' Black identities. Like I would read these books that were like, yes, this is a thing. And I was like, okay, I need to marry the two and really think about, how does your Black identity, your nativity as a Black birthing person influence the way you are experiencing racism? Because this isn't a matter of, are you experiencing it? I'm a firm believer in that every Black person in the U.S. is experiencing racism, whether they realize it or not, whether it's interpersonal or structural, that's, those are different conversations. But in my opinion, everybody's experiencing structural racism. But whether you recognize those moments, how you navigate those moments, how your body feels during those moments, whether your cortisol spikes in those moments, that all has actual translations to your health outcomes. And so the approach is out of, obviously intellectual curiosity, but it's also largely a methodological approach to assess how varying exposures to racism in the US results in different outcomes. And so quantitatively we find that outcomes are different between the three populations. And then I conducted a qualitative portion of the study as well to look at how these three groups talk about their Black identity, and then how they navigate perceived discrimination. So both identity discrimination. And so now this new project that I'm doing through the Health Equity Scholars for Action program with Robert Wood Johnson Foundation is investigating structural racism as opposed to just interpersonal, because I'm mainly focused on interpersonal racism before.
Okay. That was a lot. That was a lot of.
Yeah, I can talk about that for a long time. So sorry.
No. I'm glad, because I think that's a perspective that's very important, because I think often we think about data, and we think about like we hear a lot about othering data. So, for example, many times you would see Alaskan natives slash Pacific Islanders all like packaged into one group, and then, like, to your point, even when we look at Black or white or any other different race demographic, it isn't just like one monolith. And like how do we look across those differences within those groups to see how different things are impacting them, and what are those effects? Because I know that there's data out there, I want to say, for Caribbean, I think Caribbean people who migrate to the US, how they're we know, like, the maternal what am I maternal birthing crisis for Black women, for Black birthing people out here. And I've heard, or in the research, that it takes like 1 to 2 generations for those impacts to be seen in people that move across from the Caribbean. And just thinking about, like, why and like how, and then like what does that mean in a public health perspective. And I think it's also telling that you're talking about you went and did this minor in sociology while other people did epidemiology. And I think we oftentimes might lose some of the pieces of the important work of thinking about the sociological aspects of things. Public health does a good job, but sociology does a really great job of that. So I'm glad that you're able to like tie all of that into the work that you're doing.
Exactly. Well, I agree.
And yeah, I would love to set up some more time and we could chat more about that research that you're doing there, because I think that is fascinating, and I think it's something that we don't think about or hear about enough.
I would love that. I mean, but I can talk about it all day, because a lot of people are not talking about the diaspora. I can talk about it all day.
No, we'll figure something out.
Okay.
So were there any PhD takeaways that you wanted to share with us?
I think, it's important to hold on to the vision of what you want and advocate for that. When I was working on what my dissertation project would be, from my first year, I knew that I wanted to do this like diasporic focus on Black maternal health. And I did get some pushback on my committee about why white women weren't included. And that could have been a moment where I was like, oh yeah, let me just put them in there, as you're suggesting, this like quote unquote, gold standard to measure to, because it was the argument was, how can you tell if there's a disparity if you're not comparing them to white women, and just even if you say that out loud, you really hear in there what's happening. And that could have been a moment where I was like, okay, sure, yeah, I'm gonna put them in there. Committee members recommending it. But instead I doubled down and I turned to sociology, and I grabbed citations and I did my research and really pushed on this project should solely focus on Black birthing people. And that was important for me. And so I was glad I pushed for that. And then I'd say like persevering, I feel like you have to be a slight masochist to get a PhD. It is grueling work. But yeah, holding on to your spirit in that time and just remembering why you're there and focusing on that and just advocating for that during your journey. And I was very fortunate. I had an amazing dissertation chair who was really a mentor, a champion for me, an advocate for me, really allowed me to just have a much better experience than I could have if that wasn't true. So I'm very thankful for that too.
And you're the founder and principal consultant at Interdisciplinary Health Equity, LLC.
Mm-hmm.
Tell us about the journey of starting that, and what do you do?
Right. So, when I was getting my master's, I mentioned that that was my first contracting job or consulting job with Wayne County Health Department. And then from that to, fast forward to teaching and mentoring and research and contributing to the field. And the pandemic happened in 2020. So I guess 7 to 8 years after my first consulting job. During that time, I had a lot of little consulting gigs with different like departments or like research groups, and mainly doing workshops on like methodologies or something about health equity or maternal and child health. And I realized that I needed to like make that more formal. And so I created and founded Interdisciplinary Health Equity, which is a consulting company that addresses structural health inequities and really helps organizations develop strategies for meaningful community engagement, but also helps advise like program planning and research projects, and really focus on just improving equity. So that's done through consultations on projects, whether it's evaluation, research, developing curriculums, but also through speaking, talks, panels, and then also through coaching, like leadership coaching with teams and orgs as well.
What do you enjoy most about this work that you get to do?
The most fulfilling aspect is definitely what feels to me like a more immediate impact than I can have, say, in the academia setting. So that's definitely the most fulfilling. And then working with like really cool, different partners and innovative organizations who are doing amazing, super cool work, like digital health tech companies and nonprofits and some great like research academics too, like working groups. But yeah, I think the varying clients that I get to work with who are doing amazing things, and then like what feels like a more immediate impact.
That makes a lot of sense.
Mm-hmm.
And you mentioned this earlier. You were also a Robert Wood Johnson Foundation Health Equity Scholars for Action program member of, I don't know what is it, yeah, recipient. And the work that you're doing there, you said, is focused on Black nativity and maternal health, severe maternal morbidity inequities for Black birthing places across the diaspora. Can you share some insights that you currently have on that work?
Mm-hmm. So this work is an extension of like the previous work that I've done, but I don't want to give away too much. But so far, really, the insight that I feel like the largest insight I think I've gained this time is really the power of community. It's hard to assemble a community advisory board and partner with community orgs when you're doing a project that's not funded as well. And luckily, through the Robert Wood Johnson Foundation, it's like a $260,000 research grant. So a lot of funding and support there to build like a really amazing board with plenty of people on it and being able to compensate people for their time, which is really important. You can't, it's essential. And I'd say the power of community has really been able to come through for me in this approach because they've really been a part of, like they helped create our data collection tool. They helped figure out our recruitment approach. Like they've helped to refine our recruitment protocol. Like I hope that towards the end, they'll help with developing dissemination, So I think really the power of community has been my greatest insight from this project so far.
And in that work, do you all work as a cohort or have like some sort of cohort meetings or anything like that?
Well, so we have community advisory board meetings
Okay.
every other month usually, although it's going to go to monthly for a short period of time with the changes in the protocol. But every other month we meet as together. The research team and the community advisory board team meet together.
Okay.
Mm.
And it seemed like you're teasing us on this research and the outcomes there. So if somebody did want to stay attuned with what's going on and the work that's going on, where should they look out for that?
So we do have an Instagram. It's BN as in Nancy, M as in Mary, H study at well, on Instagram.
Okay.
BNMH study on Instagram. Um, And yeah, I mean, I'd say I think, I guess, like, to give some insight, um, this was shown a bit in the previous work that I did, but I really like to emphasize it because sometimes people think the diasporic approach could divide, um, as opposed to create like a sense of community, and that's really um, not the goal. And I think one thing that this project highlights more so than my previous work is that all Black birthing people are experiencing structural racism. Um, but it truly, the different communities they're a part of, the different, cultural approaches that inform just the way they navigate their care, the different resources that they have, all influence how experiencing that structural racism might influence their health. So we're all experiencing it, but the magnitude of the impact it has, and the way it impacts is can be different. Um, and this can be different within the foreign-born population as well. Like African immigrants and Caribbean immigrants are having two different experiences. So, this isn't a U.S. born foreign-born thing. Like there's also experiences that are different within the foreign-born. And if you went even deeper by country, you see different experiences there too. The Haitian immigrants in New York City are having a very different experience than the rest of the Caribbean cohort they would be included in. And in fact, in this study, we do look at Haitian immigrants in particular on their own as well, just because of what has happened politically in that country in the past few years. There's been a large influx of Haitian migrants to New York City. And so we knew that the Caribbean group, might be skewed a bit if we didn't also consider having the Haitian immigrant group being in their own pocket because of their recent migration, also the trauma they've experienced, because trauma definitely affects maternal health. So yeah, I'm forgetting the beginning of that question, but basically, I guess the insight is that everybody's really different, although they're all experiencing structural racism, which is the problem, and that's what we need to intervene on, because that needs to be eradicated essentially, so that we can have Black birthing people give birth and come home.
Absolutely, absolutely, and yeah, that like I'm thinking about this more and more, like just that the diversity and differences in within those populations, and oftentimes maybe like we think, oh, it's too hard to think about these specific populations. Let's just keep it as all Black or all African American, and I think we do ourselves a disservice in that, in understanding what are the nuances, and to your point, like what's the magnitude of the exposure and how is that impacting these communities, and maybe even like where are the communities that we need to like really focus in on, or how do we focus in on with these specific communities. So I think
Ex-
yeah, you go ahead.
no, that's exactly it, because it's like, this problem has persisted for, you know, decades, if not centuries, right? And we keep on intervening in the same way, creating these like evidence-based gold standard programs that focus on like taking your prenatal pills and doing this. And like, luckily the field has been innovating a lot lately and coming up with like, really cool doula programs, and really cool like community-based programs, and like, mobile clinic types of programs. And, we also need to think about the ways we can create like community custom tailored programs that really think about like who's making up these different communities and how can we figure out the needs of that community and then intervene on that. And it's also a data justice issue from a quantitative standpoint. If we're collecting um, data by race and treating every racial group as a monolith, then we're masking the true effect of the inequity. And we already see that, for Black mothers, it's like 2 or 3 times more likelihood of experiencing severe maternal morbidity. In places like New York, it's much even higher than that. But if we're masking there, and we know quantitatively from the limited literature that we have that African immigrants proportionally experience adverse maternal health rates and adverse rates for their infants at a rate that's more similar to white women. And then you have Black Americans who are experiencing it at double the rate of African immigrants. You have Caribbean immigrants who are somewhere in between those two, and you're lumping them all together, where of course you're masking the true effect of racism and how it's impacting the black birthing population. And so from a quantitative standpoint, this is a data justice issue too, because we're invisibilizing populations that exist, right? And we see that quantitatively across a lot of different, disabled people, indigenous populations, Middle Eastern populations. There's a lot of people that we collect data on and have them check boxes that don't fully capture their lived experiences and their experience with racism. And I think that's only in service of the opposite of what our goal is. So it's a data justice issue as well.
Yeah, and I haven't heard that word or that phrase data justice enough, but I think I'm definitely going to continue to use it. And I think, especially as we go forward with this administration and the changing landscape that we are in, there are going to be many, many more of these data justice issues. And I think like it's going to be a challenging time for us to like really get data that is specific on populations going forward. But it is definitely probably even more needed now than ever.
Yes, I agree.
Well, thank you for doing that work. And I guess we could continue to have those conversations as things unfold. And as I said earlier, like let us know how we can help and support you as well.
Yeah,
Uh,
absolutely.
so before I move you on to the Furious Five, this is I think this is the second time of introducing this. So I guess you're the second guest to get this introduced. It's a new question that all guests are gonna get. You're the second guest to get it. So the
Yeah.
past week's guest is gonna leave a question, and then you're gonna answer it. This week's question is: what is one underappreciated skill or quality that you think every public health professional should develop?
I think learning cultural humility, essentially, like learning to talk to, engage with people who are outside of your expertise, outside of your lived experience, outside of whoever you surround yourself with at your dinner table. I think that's really, really important in public health, where we're supposed to be concerned with the health of the population of the nation, not just the population of people who you resemble or feel like they're in your community. I think that's very undervalued.
So moving on to the Furious Five. 5 questions I ask all guests.
Okay.
Number one, what advice would you give to a student trying to pursue a career in public health?
Hmm. Well, I give advice to my students often. It, honestly, I hate to say this because people always say this, but it does depend on the what they're trying to do. But in general, I'd say take your time to find the thing that you really love. There's so many different things you can do in public health, from like water and sanitation and hygiene, environmental stuff, to maternal and child health, to more like, communicable diseases. There's such a range. So really taking the time to figure out what you think what you want your focus to be, like what you would do even if you weren't getting paid to do it.
Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
Become comfortable with failure. Don't be afraid to fail. Because I'm sure this is like a saying that someone said, but if you're like not feeling, then you're not trying. That's what I tell my kids all the time. My 8-year-old and 6-year-old. My 6-year-old is a budding perfectionist, so I'm like on an anti-perfectionism journey right now. And I like don't know where she gets it from, but I also do. And so together, I'm really trying to get her comfortable with it's okay to make mistakes. It's okay to fail even at something. That's good. That can be a good thing. You learn so much when you fail at things. And without that, it probably means you're not trying hard enough. You're not pushing yourself to do different things enough. Yeah.
Number three, what's something you're working on improving in your life right now?
Finding harmony between motherhood and my career. I think that's something that I'm really trying to push for now. I work more than I would like to. Yeah. So being real transparent and vulnerable here. But yeah, that's what I'm trying to find harmony with, to in all honesty.
Well, you appreciate the vulnerability.
Yeah.
Number four, professionally, do you recommend anything?
Professionally, to recommend anything. I mean, I feel like this is a classic, but The Body Keeps the Score. It's a good one. Mountains Beyond Mountains podcast. If I could recommend a podcast, I would do Shiny Epi People. It's a good one. Um, this one, Public Health Careers, is a good one if you're trying to figure out professionally what you'd like to do. Anything that exposes you to all the variation in public health, because there's just so much.
Appreciate the shout out.
Oh, and then also Legacy.
It's a podcast?
No, it's a book, Legacy by
Nice.
Dr. J. Blackstock.
Hmm.
I have it like the book itself, but then also an audio, and it's really nice to listen to the audio book of it.
Awesome. Well, I will be sure to add those to the show notes for anyone that's interested in checking those out. And then number 5, last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
Dream more. Earlier, like I joked earlier when you said if I always wanted a PhD or not. And I was like, well, I'm the eldest daughter of Haitian immigrants, so I think that was kind of their decision. But in reality, I was always kind of an academic person and a bit of a nerd. So that was like my path that was set out for me by my parents. And so a lot of times it takes really like life experiences to get you to realize, you know, you need to focus and develop your own dream too. And I wish I could tell my younger self, don't be afraid to dream more. Like, again, with that failure thing, don't be afraid to fail. Dreaming is good. It might lead to more failures and mistakes because you're not following a direct path always and you're doing things differently. But just keep on dreaming. Dream more. So, yeah.
Love that. Love that. Well, thank you so much, Yana, for coming on today and sharing your expertise and experiences. I feel like there's a lot that we could have dived in and spoken more about, but we will save that for some other time.
Okay, that sounds great. Thank you so much for having me. It's been so fun.
Yeah, it was my pleasure. Grateful for you to make some time and looking forward to connections in the near future as well.
Absolutely.
Housekeeping items, everyone. Thank you all so much for watching. Be sure to subscribe if you have not as yet. Leave a like, leave a review, and share it with a friend. This really helps the show get out to more people, and definitely appreciate that. Have a great week. See you all next week. Peace, everyone.
Bye.